When Brent Chapman was 13 years old, he took a Christmas basketball game off with a pretty ordinary headache and reached for a pretty ordinary painkiller, ibuprofen, something he'd taken plenty of times before without a second thought. This time, it nearly killed him, and it took his eyesight for the next 20 years. This is the story of how a man got his vision back using his own tooth. Quick thing before we get into it. If you're new here, this channel is all about strange, unbelievable true stories, and this one might be one of the wildest medical cases you'll ever hear. If that's your kind of thing, go ahead and subscribe, and if you're already here, a like on this video genuinely helps a lot. Alright, let's get into it. So Brent takes this ibuprofen, and almost immediately, his body reacts in a way nobody could have predicted. It's a severe, extremely rare drug reaction, and it hits him hard and fast. His skin starts burning, and that burning isn't limited to just his skin either. It reaches the surface of his eyes. Within a short amount of time, 13-year-old Brent is in a coma. He stays there for 27 days. When he finally wakes up, his body has survived, but it hasn't come out unscathed. He's lost his left eye completely, to an infection that took hold during all of this. And the vision in his right eye, the one eye he has left, is almost entirely gone. What Brent had gone through was something called Stevens-Johnson syndrome. It's a rare and genuinely dangerous reaction that the immune system can have to a medication or even an infection, and it can happen to anyone with any drug at any point in their life, even if they've taken that exact same medication before with zero issues. Certain drugs carry a higher risk, things like seizure medications or specific antibiotics, but the truth is, doctors still can't always predict who it's going to happen to. In Brent's case, it caused this massive wave of inflammation across his skin and his mucous membranes, and unfortunately for him, that included his eyes. In some patients, this reaction is severe enough that the immune system actually destroys something called limbal stem cells, which are these tiny but essential cells that keep the surface of the cornea clear and healthy. Lose those cells, and the cornea starts to scar over. It essentially grows a layer of skin-like tissue across itself, which blocks light from ever reaching the retina. Basically, imagine your eye's windshield slowly turning opaque, and there's nothing you can do to stop it. For the next 2 decades, Brent tried to fight his way back to some kind of normal vision. Close to 50 surgeries, most of them cornea transplants, trying to give that one remaining eye a clear window to see through again. And every single time, it was the same disappointing pattern. A new cornea would go in, and for a while, things would look promising, but it would never really heal properly. Sometimes it lasted a few months, sometimes it lasted a couple of years. But it always eventually failed. 20 years, 50 surgeries, and Brent was basically out of options. That's when a specialist named Dr. Greg Moloney, a corneal surgeon out of the University of British Columbia, offered him something almost nobody in the world even attempts. A procedure most people have never heard of called osteoodontokeratoprosthesis, or, put more simply, tooth-in-eye surgery. Here's what that actually means. Surgeons go in and remove one of the patient's own teeth, specifically a canine tooth because it's the longest tooth in the human mouth, and they take it along with a thin sliver of the surrounding jawbone, which keeps the tooth alive and supplied with blood even after it's been removed. From there, that tooth gets carefully shaved down into a small block only a few millimeters thick, and a tiny hole gets drilled straight through the middle of it. Into that hole goes a small plastic optical lens. Then, and this is the part that sounds almost unbelievable, that shaved down tooth with the lens sitting inside, it gets implanted into the patient's own cheek or eyelid. It just sits there for months while the body's soft tissue slowly grows in and around it. Why a tooth, of all things? According to Dr. Moloney, it's actually kind of the perfect material for this job. It's hard, it's rigid, it can survive in an environment that would destroy almost anything else you try to implant. And because it's the patient's own tissue, their body doesn't reject it the way it kept rejecting all those donor corneas. Once that tooth and lens structure has fully bonded with living tissue in the cheek, surgeons remove it and bring it to the eye itself. They create an opening at the front of the eye, and they surgically attach this new tooth lens complex right into that space, essentially replacing the job the cornea used to do. Tissue from inside the mouth is used to cover the tooth portion, which actually gives the finished structure a slightly pink tone. And as long as everything behind that structure, the retina, the optic nerve, is still healthy and intact, light can now pass through that little lens and reach the back of the eye again. The entire procedure happens in 2 separate surgical stages, and altogether it can take upwards of 12 hours. It's also incredibly rare. Only a small handful of surgeons anywhere in the world are equipped to even attempt it. For Brent, the tooth extraction happened back in February. The tooth lens structure was implanted into his eye in June. and one final procedure in early August straightened out the lens to correct some remaining visual distortion. On August the 13th, Brent was fitted for glasses for the very first time in this whole process. He came out with 28/30 vision, meaning at 20 feet away, he can now see the kind of detail someone with perfect eyesight would need to be 30 feet away to see. The very first thing Brent laid eyes on, quite literally, was the skyline of the city, looking out from the 16th floor of Dr. Moloney's office. And by his own account, it was almost overwhelming. An entire living city, moving and connecting all at once, in a way he simply hadn't been able to perceive for 2 decades. He and Dr. Moloney reportedly made eye contact for the very first time in that moment, and both of them got emotional. Brent hadn't been able to make real eye contact with another person in roughly 20 years. Before all of this, Brent had genuinely started to lose hope. He'd run out of options. Every new transplant felt like it was on borrowed time before it even went in, and that constant uncertainty had shaped his entire life. He'd become afraid to plan for the future at all, because there was always a chance the next infection or the next failed surgery could derail everything. Now, for the first time in a long time, Brent's actually looking ahead. He's talked about wanting to travel. Japan's at the top of his list. He works as a massage therapist, and he's looking forward to getting back into it full time, after years of having to take time off for surgery after surgery. And he's mentioned that one of his favorite things to look at these days is something incredibly simple: his young niece and nephew, 4 and 2 years old. Dr. Moloney summed the whole thing up pretty simply. Watching someone regain their sight after this long, he said, is a little like watching someone step out of a time capsule and slowly reintroduce themselves to the world around them. They've been working with Brent since he was a teenage boy. He waited until he was 34 years old to finally see the world clearly again.